For 40 years, 399 black men walked into government clinics believing they were receiving treatment. Not one of them was ever given a single dose of medicine. The doctors knew exactly what was wrong with them. The cure existed, and the United States government made a decision to let every single one of them deteriorate anyway, then filed the paperwork and called it a study. In 1932, the United States Public Health Service launched a medical study in Macon County, Alabama. The county was one of the poorest in the American South. The men who lived there were black, they were sharecroppers, and they had almost no access to medical care of any kind. The Public Health Service arrived with a promise: free medical exams, free meals on the days they came in, free burial insurance. For men who had nothing, this was not a small offer. It was everything. They came in by the hundreds. They rolled up their sleeves. They let the doctors take their blood. They trusted the uniforms and the clipboards and the official letterhead. They were never told what the doctors were actually looking for. They were never told what the study was actually about. They were told they were being treated for bad blood, a term that meant different things in different contexts and meant nothing specific at all, which was exactly the point. The men went home believing they had received care. The doctors went back to their offices and recorded what they had actually found. 399 of those men had syphilis. Not one of them was told. The study was designed to observe the natural progression of untreated syphilis in black men. That was the clinical language. What it meant in practice was that the United States government had identified nearly 400 human beings with a serious infectious disease and had made a deliberate institutional decision to watch what happened when that disease was left alone to do what it does to a human body. The men came back for their appointments. They received what they were told was treatment. They were given aspirin. They were given vitamins. They were given iron tonic. None of it treated anything. The doctors monitored them, took their measurements, recorded their deterioration, and filed their reports. The study continued. In 1947, penicillin became the standard treatment for syphilis across the United States of America. The cure was no longer experimental. It was available. And it was being administered to syphilis patients in hospitals and clinics across the country. The men in Macon County were not given penicillin. The Public Health Service made a specific decision to ensure they did not receive it. When some of the men were drafted during World War II and referred to local draft boards for standard medical processing, the Public Health Service contacted those draft boards directly and arranged for the men to be excluded from treatment programs that would have cured them. This is documented in the correspondence that survives. The government did not simply withhold the cure. It actively worked to make sure the cure could not reach them from any direction. The men continued to come in for their appointments. Some of them had been coming for a decade by then. Some of them brought their sons. Some of them told their neighbors that the government doctors in Macon County were good people who took care of you. The program had a local nurse named Eunice Rivers, who the men trusted completely. She drove them to their appointments. She called them by name. She was not told the full scope of what was being done, and she spent years believing she was helping. Her presence was not incidental. The Public Health Service understood that a familiar face, a black woman from the community who knew their names and their families, made the men more likely to keep coming back. She was a tool in the program the same way the aspirin was a tool. Everything was calibrated. By the late 1960s, the study had been running for more than 30 years. The men were old now. Many of them had died. The autopsies which the families had been encouraged to consent to in exchange for burial insurance, provided the data the researchers had been collecting toward for decades. The men had signed away the right to a private death without understanding what they were signing. The paperwork had been careful about that too. In 1966, a public health service employee named Peter Buxton read the study documentation and wrote a formal letter of concern to his superiors. He argued that the study was ethically indefensible. He was told the study would continue. He wrote again in 1968. He was told again that the study would continue. He was not a journalist. He was not an activist. He was an employee inside the system raising a concern through the correct channels, and the correct channels produced nothing. He held on to what he knew for several more years. In 1972, he gave the documentation to a journalist named John Heller. On July 25th of 1972, the Associated Press published the story. The next day, it was on the front page of newspapers across the country. The study was terminated within weeks. By the time it ended, 28 of the men had died directly from syphilis. 100 had died from related complications. 40 of their wives had been infected. 19 of their children had been born with congenital syphilis. The men who were still alive had been participants in a government study for 40 years without ever understanding what they had participated in. A class action lawsuit was filed. In 1974, the United States government settled for $10 million. The surviving participants received lifetime medical benefits. The families of the deceased received a smaller settlement. No one was criminally charged. No physician who participated in the study faced professional consequences that ended their career. The men who ran the program in its early decades were dead by the time the story broke. The ones who were still alive gave statements. The institutional language used to describe what had happened was careful and consistent. It was a different era. Standards were different. The decisions reflected the limitations of the time. In 1997, President Bill Clinton issued a formal apology on behalf of the United States government to the 8 surviving participants. The apology was given in the White House. The men sat in the front row. The president looked at them and said that what was done was shameful and that the government was sorry. The men accepted the apology. Several of them wept. One of them was 100 years old. The last survivor of the Tuskegee syphilis study died in 2004. His name was Ernest Hendon. He was 96 years old. He had been 24 when the study began. He had been going to those appointments for decades before he understood what they actually were. He lived long enough to receive an apology from a president of the United States of America. He lived long enough to see the story in history books. He did not live long enough to see a single person held accountable for what was done to him. Not one. In 40 years of a program that infected wives and children and buried men whose autopsies were paid for with burial insurance, not one person was ever held accountable. The paperwork still exists. The records are still there. And the formula that produced them has never been dismantled. The Tuskegee study is the one that gets mentioned. It is the one that made it into the textbooks. The one that gets referenced when people talk about medical mistrust in black communities, the one the government eventually apologized for. But it is not the only one. It is not even close to the only one. There are studies that have not had their Peter Buxton yet. There are files that have not had their John Heller yet. There are men and women whose names are still inside institutional records that no journalist has connected to anything yet. That is what this channel exists to find. If you are the kind of person who needs to know what is in those records, you already know what to do.